What's the role of pharmaceutical agents in diagnosis and localization in Horner syndrome? You can use cocaine eye drops. They come in 4% and 10% for this reason. And the mechanism of action of cocaine is to prevent from reuptake of neurotransmitter norepinephrine in this case. So it's a neurotransmitter inhibitor. And if there is Horner syndrome, the affected eye, when you apply the eye drops, the diameter of it is not going to change. But the contralateral side, the good side, you will see dilation of the pupil, and so the anisocoria will become more pronounced after applying cocaine eye drops. So that's how you can confirm your diagnosis. But then to localize, just remember that you have three orders of neurons: the first order, second order, and a third order. First order going from the hypothalamus to the lower cervical spine, upper T-spine. The second order from there to the superior cervical ganglion, the sympathetic ganglion, and then the third order is the postganglionic neurons which will travel with the ICA and eventually will go to the eye. So the pharmaceutical agent to localize the lesion in this case is hydroxyamphetamine. The function of the hydroxyamphetamine is to help release the neurotransmitter. And it's used to distinguish a first order Horner's and a second order Horner's compared to a third order Horner syndrome. If you have a third order Horner syndrome, after applying the hydroxyamphetamine eye drops, nothing's going to change. The reason for that is this part, the last part, the postganglionic part, is not functioning, and there are no neurotransmitter there to even be released. But if the lesion is either in the central part or in the preganglionic part, after applying the hydroxyamphetamine eye drops, you're going to have release of norepinephrine in the neuromuscular junction there, and the eye will dilate. So that's one way to distinguish a first or second order compared to a third order Horner syndrome. Also remember that if the lesion is in the third order, the postganglionic part, you already have the fibers, the neurons responsible for sweating, separated from the rest of the fibers. So a patient with a third order neuron pathology will not have anhidrosis, and they will not respond to hydroxyamphetamine eye drops.